Well, good morning, everyone, and thank you for joining us for January's edition of Health Bites with Region 3. We are so pleased to welcome this month's speaker, Dr. Hannah Szlyk. Dr. Szlyk is an assistant professor in psychiatry at Washington University School of Medicine. She is a licensed clinical social worker with training in suicidology among underserved and marginalized populations and in qualitative and mixed methods study design and analyses. Prior to pursuing a PhD, she worked as a clinical social worker in school, inpatient, step down, and outpatient settings with adolescents and adults with comorbid psychiatric disorders, including substance use. Her current research focuses on development, testing, and implementation of digital interventions, or mHealth, to improve service access and treatment of substance use disorders and commonly occurring mental disorders across the lifespan. Her work is heavily grounded in approaches for health equity and collaborative relationships with community-based organizations and recovery support services. Dr. Szlyk currently co-leads an ongoing SAMHSA-funded trial of a supplemental mHealth intervention to support adherence to medication for opioid use disorder among adults that involves several Midwestern behavioral health clinics. This has led to new studies supported by the National Institutes of Health to meet the recovery needs of pregnant and postpartum people and Black Americans with opioid use disorder and co-occurring mental health issues. In today's Health Bites, our speaker will give a presentation on promotion of digital access and literacy among people who use substances. I want to thank you, Dr. Szlyk, for being our guest speaker this morning, and now I'm going to turn everything over to you.
Okay, great. So we'll get started, and thank you for that nice introduction, Margie. Like Margie said, my name is Hannah Szlyk, and I'm an assistant professor at WashU School of Medicine and Psychiatry, and I'll be talking about the promotion of digital access and literacy among people who use substances. And so before I get started, I wanted to disclose my support. So as Margie said, I am supported by the National Institute of Drug Abuse as part of NIH. And I'm also supported by SAMHSA, and some of the work I'll be talking about today has been supported by these different institutions. And I'm also a paid consultant for Google Health and Medcase. And so today, after this seminar, I'm hoping that you'll be able to understand the connection among digital literacy and substance use and digital access. You'll be able to recognize the role of lived experiences in iterating and disseminating a digital health intervention, and you'll be able to translate feedback into feasible strategies to improve digital access and literacy among a recovery community. Okay, first, a little bit about me. So I'm a cisgendered white female. Besides being a researcher, like Margie said, I'm also an LCSW. I'm originally from New England, specifically New Hampshire, but I've lived in St. Louis for a total of 5 years right now. And digital tools were not always prominent in my own life. My family was much slower to have the latest tech device. I also did not grow up with Facebook. So Facebook came prominent when I was about to start college, which I'm also fortunate that happened. And I also got my first smartphone in 2009. So in my own research, I believe that equity must be a key element of mobile or mHealth. So originally, I studied youth suicide prevention and observed how traditional models of practice and service delivery did not work for many youth. And then this brought me to studying the potential utility of crisis lines and crisis text services to address gaps in engaging youth outside of a clinic. I then became interested in and started to study the use of other mobile health tools and interventions to promote behavioral health in general, including among adults. But then again, I observed that the same disparities in youth interventions and in-person care were being perpetuated in digital care. So not everyone and all needs were included in the design and delivery of mHealth interventions, and this is what I'll be talking a little bit about today. But before we go any further, I'd like to learn a little bit about you and all of your current work. And so there'll be some questions popping up on the poll. If you could answer a little bit, so this will give me a little bit of an understanding of who's in the room today. The first question is about your primary workplace setting. Okay. I think we can see what the results are now. All right, so it looks like predominantly people are from university or academic institution. Okay, great. And then we'll move on to the second question. What type of community do you work in? Okay, mostly in an urban area. Okay, good to know. And then the third question is, do you currently work with or treat people with a substance use disorder? Okay, I think we can generate the results now. Okay, mostly no. Okay, so this will be some new information for folks, which I think will also be good. And then the last question, for the following set of tech-related activities, if you do work with communities and patients, think about those communities and patients you currently work with and serve. And so you'll be provided a list of significant issues that might be experienced by your community or patients, and this is related to tech. And so please select all that are relevant to the people that you serve. All right, so it looks like some prominent themes are using a browser to look up health-related information, identifying health-related misinformation and disinformation online, as well as sending an email. Okay, but yeah, okay, great. This is good to know. And finding and applying to jobs, accessing financial information and services. All right, so great. So I think a lot of what we're talking about today will also be really relevant to everyone here on the call. Thank you for answering those questions. That's really helpful. And also, I know that some folks are newer to substance use treatment, and so I'll be talking a little bit about this, but again, happy to answer any questions at the end related to that too.
Yeah, and there are just a few in the
The chat
chat.
too.
Yeah,
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 great. Just
great.
saw those.
Yeah.
Awesome. Thank you. All right. So, as much of you were kind of answering and indicating, digital literacy is now considered a social determinant of health. So, digital literacy is the varying ability to use technology to create, communicate, find, and evaluate information. But as you probably all have experienced, certain groups have lower digital literacy than others. So these examples might include older versus younger adults, people of color versus people who are white, people who live in rural versus urban or suburban areas. Um, in the changing landscape of digital health, those who have lower digital literacy may encounter even more difficulties. And so these difficulties could be inability to access or understand health communication in an electronic health record system, difficulty making telehealth and in-person appointments. Like many of you indicated, this might also include accessing insurance accounts and searching for services and new providers. And because of this, those with lower digital literacy may experience poorer health outcomes and therefore lower quality of life. So today I'll be talking about digital access and literacy in the context of St. Louis, Missouri. And this is where I live and where much of my work is located. Our research team collaborates with substance use clinics and centers for recovery services in the area and the greater region. And so here it is often said that St. Louis has a digital divide. Here, many families are unable to fully participate in economic, educational, and healthcare systems, and many live below the poverty line and therefore have lack of access to one of these different factors. And that can include coverage of broadband or Wi-Fi, quality of the broadband service, having an affordable broadband service, having affordable tech devices, and then having sufficient digital literacy, or if not, being able to find mentorship to improve that digital literacy. If you're familiar with the region, you might hear about North and South St. Louis, and this division is a result of both historical and ongoing structural racism. This is also called the Delmar Divide, So north of Del Mar, and this is a street that runs through the city, the neighborhoods have been impacted by segregation and historical intentional neglect by the city and the state government. These areas primarily are disproportionately Black neighborhoods, and about 44 to 50% of the residents live below the poverty line. In the south part of the city, there's also other disparities, but we do see that this population has a larger white and middle to upper middle class population. And you'll see here on the right, there's actually a map of St. Louis, and it kind of looks like a teardrop. And the map indicates, like I just said, that households in the North City wards have the highest needs related to broadband adoption and availability of future-proof infrastructure. And then there are some households in the South City that also struggle with low broadband adoption and high-speed broadband availability. But overall, about 250,000 to 300,000 people in the whole area lack access to fiber internet. And while broadband coverage and equality exists across St. Louis, some areas have slow speed. And so about 150,000 households or even more struggle to afford high-speed broadband, while about 90,000 lack adequate devices like smartphones and laptops. Fortunately, there are a lot of ongoing efforts to invest in high-speed broadband access. This includes investment in having access to affordable devices. So a lot of grassroots organizations are working to provide people with lower cost or free smartphones or laptops. There's also efforts to facilitate technical support and training. And so it's estimated about 100,000 adults in the area would benefit from additional digital training. And it's also really important that these efforts coordinate with local community organizations to help to combine the device distribution, but also to promote trainings in digital literacy. Community-based substance use disorder treatment and recovery centers do need to be included in these efforts. So similarly, these disparities in access and literacy are observed among people who use substances in the greater St. Louis region. North City and County experience more overdose-related deaths than other parts of the city and county, but these areas have fewer substance use disorder resources and services. So thus, we observe that people who use substances, especially people who belong to the Black community or who are lower income, may encounter more barriers to digital literacy and access than people who belong to other groups. This divide significantly disconnects people from recovery and treatment services, access to health information, and opportunities to pursue affordable housing and job assistance. People who are reentering society from the justice system may especially struggle with digital literacy, as they likely did not have opportunities to access the internet or learn new digital skills during the time of incarceration. So over the past several years, especially since the onset of COVID-19 in 2020, there has been an influx of digital intervention services and services also available via telehealth. And these services are very helpful in addressing some barriers to in-person care, like transportation, sufficient time for appointments, being able to find childcare during those appointments, having consistent communication with a provider, being able to have privacy and comfort during an appointment, and even having lower costs of services. Yet people with low digital literacy and less access may miss out on the benefits of telehealth and mHealth interventions and thus encounter additional challenges for recovery. So a person without a personal device or reliable broadband might not be able to access virtual peer support services or their telehealth appointments. They might have difficulty accessing supplemental mHealth interventions that can support in-person care. They might not be able to access accurate information surrounding MOUD. And MOUD stands for medication for opioid use disorder, and it's really the gold standard of treatment for recovery from an opioid use disorder. And with virtual telehealth, this service has been really critical for many people to be prescribed MOUD and then to receive timely refills. So you can see that the digital divide can truly impact a person's recovery trajectory, especially with medication. And economic and education opportunities are often already limited to many people because of an SUD, a substance use disorder. So without a personal device or reliable broadband, a person might not be able to email for jobs, access their insurance profile, apply for Medicaid, and locate affordable housing. So therefore, this can impact their ability to pursue independent living. To further hammer the point home, as a researcher and clinician, I strongly believe that digital interventions are really important for people in recovery and that they can be used to bridge gaps in in-person service access and availability. But if we don't address digital literacy and access, we're really putting people at a disservice, and it really can impact the effectiveness of the interventions that we design and implement. So thus, it's really important that we address digital literacy and access if we really want to reduce health disparities, especially in the context of the modern day health system. And so I have humbly learned these lessons personally through my own work and research. Our research team at WashU has been disseminating a free mobile health intervention called You Matter. So it's pronounced You Matter and is also based on another acronym for medication assisted treatment for substance use disorder. And so we've been reaching adults in the greater St. Louis region for over 5 years now. This service is sponsored by the State Opioid Response Initiative through SAMHSA, and we recruit about 30 people per month, and participants can be compensated for using the app if they complete surveys. Results from the surveys are then used to further refine the app and also to further the literature on substance use disorders in communities. Many of our participants are lower income and have been impacted by the effects of structural racism in greater St. Louis. Most of the people we work with are unemployed and on Medicaid. And so while We Matter has been well received by participants and effective in supporting substance use recovery, we have seen that many participants have trouble downloading the app and then navigating the features of the app, as well as accessing the gift cards we give them for completing the surveys. And here you'll see on the right, that is the home page for the app. And so I'll talk a little bit more about the app itself and its features as we move forward. Okay. So if participants are able to log into the app, they can benefit from a whole host of features. These features include educational content and curricula about substance use disorders in general, but also about recovery care. There's a directory of local, virtual, and national resources related to recovery and independent living. We also have an in-app goal tracking feature in calendars. There are daily and weekly assessments so people can see how they are progressing in their recovery. We also have a sober day tracker so people can record how long they've been going without using a certain substance or participating in a certain behavior. And they also have access to a personal e-coach within the app. And so you'll see here on the left, there's a snapshot or an example of what that e-messaging feature would look like within the app. And through follow-up interviews and other conversations, participants have informed us that they needed more help with the logistics of the intervention. And so some of the difficulties have been receiving their e-gift cards for completing surveys, for being able to access the links that we sent them through email or through their smartphones, being able to participate in the video and phone interviews, being able to download the app from the App Store or Google Play Store, having some trouble with their internet connection on their smartphone, having a working smartphone, and navigating some features of the app. And so some of the things we've done so far is that we have created a digital literacy screener and survey questions for our participants to complete up front. We've also created a digital literacy brochure and an e-gift card guide, which I'll talk more about now. And so here you'll see on the right, it's a digital copy of our digital literacy brochure. And so a lot of the time we're actually meeting people in person, so we can give people a hard copy of this brochure, and it has instructions on how to download the app from the Google Play Store or from the App Store. It also has a list of the features to remind people what they can use within the app, and it also shows a snapshot of the homepage. And so you can see on the homepage, there's announcements that we can send to all of our participants if needed. Mainly, we have an inspirational quote each day that pops up. There's usually a greeting, and the greeting will also include the person's first name. And they'll have the sober tracking details if they're participating in that. Their weekly goals will show up. There's that daily calendar. Also, if they need to complete daily and weekly assessments, that will also pop up. And then there's some reminders of some of the different education and curriculum activities that they can participate as well. And so, like I said, this can be kind of a visual aid to our participants when they're getting to know the intervention. Um, we generally hand these out at our in-person enrollment events. So even though we are an M Health intervention, we find that in-person communication is also really beneficial and gives us the opportunity to really get to know the people we're going to be working with, and then the eligible participants also have the opportunity to ask us important questions about the research process. Okay. We've also seen that some participants need a little extra assistance. And so sometimes we do provide tech support via phone. They'll call the lab phone number. Or sometimes if a facility is nearby to our office, to the WashU campus, we'll actually visit the client if they're at the facility where we recruited them from, to go over maybe even setting up email, downloading the app, and then completing the online survey. Okay. And here you'll see on the right, this is an image of our e-gift card guide. And so this has been a trial for us. So originally we were giving people hard copy gift cards, um, but we were seeing that sometimes those got stolen or misplaced, or if someone, was maybe having to go to different facilities for their treatment or even leave the region, that being able to find the person and give them the hard copy gift card could be difficult, or if gift cards got lost in the mail, that often happened. So, if possible, we really tried to send people the gift card through email. But that also brings the other complication of how to use the gift card email to actually, be to use the gift card allowance. And so one of our research assistants created this handy guide that shows what the email will look like and what each component of the email looks like. So here's your PIN number, here's the barcode, this is what you can show the cashier. And so far, our clients have really seemed to appreciate these efforts so that everyone can participate and benefit from the intervention. Okay. And so our participants are invited to provide feedback about the app and intervention through open-ended survey questions and a follow-up interview. And these opportunities have given our team a lot of great insight on how we can make changes to study engagement, enrollment, and content within the app. And so another really important thing, like I mentioned, that there is a higher rate of overdose among the Black community in St. Louis due to historical and ongoing structural racism. We have felt that it's important for us to prioritize receiving additional feedback from people who are part of the Black community who have used the app, as well as other people we know who are providers in the community, such as Black peer support coaches. And so we've also really prioritized getting feedback from them about the app, and we're hoping that this can increase access and usability of the app by this population. And so here on the right, we have a couple of quotes from a quote from a participant and one from a recovery coach. And the first quote really gave us insight on how a person is most like to consume information and learn. And so this person said, videos of things are helpful to me just because I get a lot more out of it versus reading a 5-page essay on something. Personal stories, people that are exactly the same and have recovered or haven't recovered, are the good, bad, and ugly. So they also want to hear from people with lived experience as well. And then this recovery coach told us some older adults don't even know how to use a computer or a phone. They don't know about the technical support that we provide, so that they would have to go to someone else just to receive the information so they can get the information. That could be a barrier for older adults. So this was really important for us to keep in mind on in terms of trying to troubleshoot and be proactive in terms of helping people when we are initially engaging them so they don't become frustrated and not know what to do with the app when they receive it. Other qualitative findings from the interviews have showed us that many participants requested an in-app guide to help with navigating the app features. So one participant said, it was not obvious when or where you were supposed to do something at what time. And this other person told us, I get frustrated when I don't understand the ins and outs of what you need to push to get to those sources. I got a little frustrated, so I just stopped messing with it. And this quote is really, really informative because it showed us what happens when someone gets frustrated or doesn't know what to do, and then they might just, just kind of give up on the app for the time being. And this through these interviews, we also became to really learn that, of course, many of our clients are juggling recovery, their own personal lives. They might not be feeling well. And so it's really important that the app does not become a source of frustration or stress. And so we also work closely with our tech developer to address any glitches so that we can make timely improvements to the user experience. And to better serve our clients, we added 5 digital literacy items to our study screener. So this is when we, meet someone, we're at an enrollment event and they're interested in participating. We provide a screener to see if they're eligible and to see if they're a good fit for the intervention. And so we hope that this would help us to be proactive with client needs up front. So here on the screener, here's the 5 questions. So the first question asks, how confident do you feel using a new piece of technology? And so they need to indicate the confidence from a scale of 1 to 10, 10 being very confident and 1 being not confident at all. On the same scale, they're then asked, how comfortable are you with your ability to follow links or open attachments that are sent to your email? And then the third question is, do you know how to get to the App Store on your mobile device or tablet? Yes, no, or not sure. And the next is a statement, and they have to respond from a Likert scale of strongly agree to strongly disagree. And they have to answer, I would like to further improve my digital and technological skills. Strongly agree to strongly disagree. And then the last question is an open response. What concerns do you have with using our mobile app? And so far, we've had about 309 participants over the past year complete these digital literacy items. And so we decided to use a quantitative approach called latent class analysis to see how the different groups of people based on their socio-demographics kind of form these latent classes are kind of hung together differently. So we can kind of understand of who are the different profiles of our clients. We then use bivariate analysis to examine differences in study compliance, as well as the self-reported digital literacy items. And so in terms of the 3 different classes that we found, class 1 can be characterized as participants who are under 50 years old, who are predominantly white, and had a history of polysubstance use. And that meant having a past of using opioids and stimulants. Those in class 2 were characterized as being primarily people over 50, male, white, having lower formal education attainment, and having a history of stimulant use. And then class 3 could be characterized as being under 50 years old and primarily having a history of opioid use only. And so we saw that participants in class 2, as compared to the 2 other classes, were less likely to complete the study surveys and engage the e-coach in the app. We also saw that they reported lower scores on digital literacy items, such as less confidence in using new technologies, less comfort with linking email accounts, and they also strongly agreed that they really wanted to improve their digital literacy skills as well. We've also seen through some other preliminary results that we see that some our clients reentering society from the justice system are also having trouble with accessing the app. We've also experienced this qualitatively, and we're working on ways to better support these clients so that they feel comfortable with using the app and that they can participate in this study. We're also looking into adding new digital literacy items so we can track change over the time of the intervention. Okay. So as I mentioned, our team has learned that it's really important for us to invest time in relationship building with the greater recovery community. And so this means that we need to engage folks as community members, not necessarily as researchers all the time. Historically, WashU has not had the best relationship with the greater St. Louis community, so it's really important that our team goes the extra mile to let others know who we are and what our intentions are. We have been partnering with the Depression Bipolar Support Alliance and St. Louis Empowerment Center for several months now. They are a drop-in recovery community center in Northeast St. Louis, it's run by all people with lived experience with mental health and substance use issues, and they provide free peer support services to supplement mental health treatment. So anyone can attend who has a mental health or substance use issue, and they really help people with working towards independent living. And so for the past several months, our team has gone to their center and provide a monthly tech office hour. So we'll be there for, one time a month, and the clients know that we'll be there for 2 hours, and we'll be hanging out in their computer lab. And mostly we're help to answer questions related to smartphone use, email, searching for recovery resources online, such as affordable housing, even where to find affordable pet care, which has been really important to a lot of clients. And we've also tried to help folks with checking the status of their Medicaid applications as well. Okay. So even though many clientele might not locate all their services via online, we've also realized that the online presence of an organization is often needed to build a network and to be eligible for larger grants. So a lot of grassroots organizations need to also think about how they can broaden their digital footprint to be eligible and to have to be viewed by some of these funders. Um, in parts of North St. Louis, especially where there might be less funded or less resourced areas, a lot of the grassroots organizations often do not have the time or the money to create and update a website or continue to design new flyers. And so we've learned that organizations really need to think of the role of technology in reaching their different audiences. That could be, different partners, funders, but also, thinking about how they will reach their clients. And so for the past year, we've been working with Living with Purpose, which is a recovery community center in the Baden neighborhood of North County in St. Louis. And we've been using some community funding or some community grant funding to help them update their website to enhance their digital presence so they can keep applying for bigger grants. We've also supported them with the digital design of door hangers to spread awareness of their resources. So that means, clothes, shoes, food, medical testing, and Medicaid enrollment at their center. And so these door hangers, they're then able to put on, at the front door of the different residents in the area to remind people of what they can offer. Okay. Just a few more slides. But beyond our immediate work, our team has also become knowledgeable about what's happening in our city, state, and nation in terms of digital literacy and access. And so we have found that our research is really timely as the state and federal government has interest in addressing digital literacy. And so, for example, I have become a member of Connect SCL, which is a city-driven initiative to address the digital divide in St. Louis. And so some of the recent successes of that group has been to bring Wi-Fi access to a lot of public parks in the city so that everyone can have access to Wi-Fi. And this organization, Connect SCL, will soon become Connect Midwest, which will be a 501(c)(3), and they aim to minimize the digital divide in the region, also beyond St. Louis, by building a network of technological resources and implementing community level program. I've also become part of a team that's worked with another organization and with WashU to apply for the Broadband Equity Access and Deployment Program funding. And so this is also another national initiative that's across the country and each state has different sets of funding, and this is really to inform and understand the gaps in broadband access across different states, but to and then be able to find different solutions. And that this funding is also through the National Telecommunications and Information Administration. It's also been really important for our team to understand the status of different phone programs. So for a while, Lifeline and True Connect phone programs were federally funded programs to provide free or discounted smartphones to folks. And a lot of the clients we serve have been able to get free or low-cost smartphones through these programs. But unfortunately, these programs will soon be sunsetting. And so this is also important for us, for our team to consider too, as we might need to consider how we can use some grant funding or other funding to help support, linking our participants to low or free cost smartphones to participate in research, but also to facilitate their daily life. Okay. So, to wrap things up, overall, our team has learned that we really need to prioritize digital access and literacy in our research. And this has meant gathering feedback from our You Matter clients on digital literacy and access. This includes being aware of funding for technology and the grants we apply for, and being able to offer resources for lower cost devices and Wi-Fi, and being aware of the status of different federal programs like Lifeline and True Connect. We need to be able to disseminate accessible and age-appropriate educational resources on technology in the app, and that could be through videos, walkthroughs, and flyers. And then finally, we do need to have some flexibility about providing remote and in-person tech support for clients as needed too. Okay. And then just to kind of return to the learning objectives for today, just as a reminder, the first was to understand the connection among digital access, literacy, and substance use recovery. The second was to recognize the importance of honoring lived experience within this work. And then finally, the last objective was to translate feedback into feasible strategies to improve digital access and literacy. So overall, time, effort, and funding really needs to be allocated to digital access and literacy. And this includes thinking about this within substance use disorder services and treatment, within general healthcare, but also in research. And in today's world, we must assume that tech plays a role in nearly all healthcare service access and delivery. But we cannot assume that someone has sufficient access or digital literacy skills to participate in a service. These are missing pieces to much of healthcare delivery and research today. And as our team has seen over the past year or so, often failures in service delivery and in research are not necessarily about the content of a service or how an M health intervention needs to be tailored for a certain population. What happens even before someone participates in a service very much matters. Okay. So thank you all for your time. I'm hoping that this was informative for you all. And again, our team is always happy to connect. Here's our email and phone, as well as some of our different social media handles. And that's also my email as well. And our lab is called the Investigators Connecting Health and Social Media at WashU School of Medicine. And happy to take any questions. So thank you.
Thank you, Dr. Szlyk. That was such an interesting presentation. I have a question. I was really interested in when you discussed that you're, trying to create community, better the community relationship. How do you go about doing that? I know you mentioned that you kind of put yourselves out there, and I know that's one of the really important things about, building trust. So if you could just maybe elaborate on that a little bit more.
Yeah, so I think, as someone who's mostly seen as a researcher right now, it can be seen as sometimes, or has been too, that researchers go in and they just take, and they're not really part of the community, and they're not really giving back, or they're not showing how they want to use what they're doing to really better people's lives. And so, providing those tech office hours, I think it shows what our intent is and what really is the um, why we're doing what we're doing. And we've really taken a lot of time to be part of different local initiatives and even being at different health fairs in the community and volunteering. Because I think especially in St. Louis, there's unfortunately been a lot of damage done, and people, researchers have gone in and not really been supportive of the community or respectful. So we're really focused on how we can help people to get to know us and so we can have those relationships. And I mean, that's the point of it, is that we hope this research can improve lives. So yeah, but it's also really nice to kind of be part of the community versus just being there, just doing research and data collection and analysis all the time.
Oh, yeah, absolutely. And do you have any plans to maybe make this app available at a broader scale?
A lot of that is related to funding. So
Mhm.
through the State Opioid Response Initiative, right now we're constrained a lot of the time by just since we're funded by the SOR dollars from Missouri. With NIH dollars, we're able to then expand some of our side projects from this app to different parts of the Midwest. But we're always, interested in collaboration with different parts of the region and exploring the other funding sources too.
Thank you. Well, I don't know if there's any other questions for Dr. Szlyk. Okay, well, thank you so much for being with us today. Really appreciate you taking your time and sharing this really fascinating work that you and your team are doing. Yeah, if anyone has any questions for Dr. Szlyk, we've got the slides. We'll go ahead and put that link in again, and you can always reach out to her and her team. Let me go ahead
I
and
do
put that
see
in.
a question
Oh, good.
from Jane Murphy.
Okay.
Vic, I can answer that. So,
Oh, it just popped up. Great.
right now, our e-coaches are members of our research team. So it's everyone who has some type of clinical background. And I'm, as an LCSW and as my co-lead, Patty Cavazos Rex, she's a licensed psychologist, so we're able to supervise the e-coaches. So right now they're just members of our team. We are exploring ways to get peer support specialists involved in the app too, because that's been something we've been hearing, is that people really want to have more peers available as e-coaches. And so we're really looking into ways that we could have peers be e-coaches, and maybe they can get additional training if that's something they want, or it could be through, they could be consultants. So it is actual people. Right now, we're not supported by AI technology. It's just us answering the questions and attending to folks. So. Thanks, Jane. And then I see Nadia about any online resources recommended. Um, I mean, in the slides, I think you'll see some of the names in the different reports that we have used some of the information from, and you'll see our lab. Um, and so I think you can go to our website and find more about You Matter. A lot of this is, just information that we've from our own research, and then some of it is related to these different reports that the city of St. Louis um, has shared. But I know in terms of the National Library of Medicine, they do have it's more focused on health literacy. They do have some worksheets on their website that also are about digital inclusion as well, kind of in a more general sense.
If that's all the questions we have, I'd like to thank Dr. Szlyk again for being with us today. And we do look forward to seeing you next month for Health Bites with Region 3.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.